I am going to speak on that you should go for fellowship and for specialized training. So before that, let's do my background check. So I finished my MD from ophthalmology, MD ophthalmology from AIMS, where we always are rotated in various units. You get exposed to each and everything. So that takes part of the comprehensive round. The units are divided according to subspecialty. So by end of 3 years, what you get is like you have a fairly good idea that okay, this is what you want. Then I finished my clinical fellowship in phaco and refractive surgery from Narayana HR. So let's go. So some of the images that I'm going to show you people may not agree and people may get offended also. So that's a subtle warning for you. Okay. So you heard the old quote, right? Jack of all trade, master of none. This doesn't apply to all, but yes, this is in a tier 1 city. If you are doing everything, you will not be considered as a specialist. What does fellowship? I mean, why do you need a fellowship? In India, ophthalmology is such an unstructured branch. You don't have NCA, you don't have DM, you don't have any university accredited fellowship also. These are what we are doing, a private fellowship. They may not stand when you go out of your country, even out of your state, somewhere like that. But yes, whatever we have, you want to stand up. So you see the bulb here, there is only one bulb growing. All bulbs are people who have completed their ophthalmology. The glowing bulb is that one who has done a fellowship. This is the extra thing that makes you stand out. Whether you do it, I did a surgical fellowship. Even if you pass a certificate exam like FICO or FRCS, it gives you an edge. You cannot be called MS ophthalmology always, right? You must have seen your peers also, right? Coming to the next part, you want to be recognized in the crowd. You want to be recognized as Dr. Vishal Arora, MD AIMS, Dr. Tarun Arora, MD AIMS, and both are MD AIMS. So what is the difference here? I mean, do you have a degree? Do you have a trained fellowship? It gives you better recognition. The SRship, unfortunately, will never write that you are a trained cornea or a trained cataract or a trained retroretina person. It always writes you had 3 years experience, teaching experience post your MD. I mean, 3 years teaching experience post your MD, I completely agree. If a place like AIMS is good, but if you go to some other medical college, you do a SRship, even if you have done hundreds of cataract surgery, if they write that, you come to a tier 1 city. I mean, I am in private practice, people don't like that. People don't take it. You should remember Arjuna. What did Arjuna see? Arjuna saw a fish, its reflection, and the eye of the fish. So that is how super specialization is. Pond or a bowl, that's your pool, then you are the fish, then the eye is your fellowship. So that is what you have to aim for. Also, you remember this quote? I fear not the man who has practiced 10,000 kicks once, but I fear the man who has practiced one kick 10,000 times. So fellowships give you a better skill development. Tarun here is doing cornea, refractive. If I have to do something, I'll ask him. She is doing vitro. Our panelist, Dr. Mohit, is doing vitro-retina. So I have somebody and they have done this in and day out. But if I tell Dr. Mohit, would you do a cataract surgery and please insert a multifocal and I want a negative asphericity on it, will he be able to do it as comfortably as I am able to do it, or as comfortably as Tarun would be able to do it? No, I don't think so. So fellowship, you want to be a master of something, you have to repeat it. In a fellowship, you keep on repeating the same thing. You keep on repeating, and you become a master. That doesn't happen in a comprehensive in the fellowship. It has its limitation. If you are working in anything less than a tier 1 city, you will have difficulty. And if you are working in a city, even in tier 1 where the concept of super specialization is new, the demand for you would be less. This I would like to sum up. Okay.